This presentation is about the coronavirus and the workplace and the advice to plan but don't panic. I am Melva Tate, the owner of Tate & Associates. We're a leadership consulting firm specializing in human resource management and career development. We're based out of Birmingham, Alabama, and we serve clients all across the U.S. 60% of our clients are nonprofits, and we are having the discussion of what to do about the coronavirus and workplace preparation on a continuous basis, day in, day out. We're helping organizations get prepared for their workforce as it relates to the COVID-19. Quick disclaimer, I am not a coronavirus expert. The information that I'm sharing is information that has been shared with me through several mediums, including information from the Society of Human Resource Management, the CDC, other firms, including law firms, who are providing information on an ongoing basis to help all of us be prepared for the virus and its impact on our workforce. You should know, if you're listening to the news, that the information is changing day by day, if not hour by hour. So I would advise you to use this information to educate and inform yourself. After listening to it, I advise you to go back and do some research before you execute your plan of action to make sure it's applicable for your organization, your size of organization, and also your industry as well. If you have questions, I would love to hear about that. You can always email me. My email address is listed at the end of this presentation, but I would love to hear what you have to say or what questions you may have. In addition to this, you'll have access to an online file of resources that shares general information about COVID-19, recommendations and sample templates on remote work and telecommuting policies. There are sample memos and policies around the virus and communicating to your team. There are additional communication tools used for employees and managers, some infographics and posters about hand washing and other valuable information that's been shared by the CDC. And most importantly, there are regulations or an explanation of federal proposed and the state of Alabama regulations as it relates to COVID-19 preparedness and assistance to workers who will be impacted by organizations' interruption in operations. I won't spend any time talking about the virus itself. I think we're all in coronavirus overload. We are hearing about it day in and day out. And of course, the information is forever changing. As I referenced previously, if you want general information to use or copy and paste about the coronavirus, it is in file 1 in the online file in Dropbox. The advice I'm giving to my clients who are executive directors or CEOs or C-suite personnel is to practice the 4 C's. That is, practice calmness, practice communication, cooperation, and collaboration as we get through this pandemic. The advice that I'm giving to leaders that I work with is to calm down at all possible, to practice calmness. This will be a true test of your leadership. Your staff may be panicking, but you need to stay calm. You need to model the behavior you want them to see, that you are in a position, you're calm enough to make sound, calculated decisions that impact the organization. One of the things you need to realize is that things are changing minute by minute, so you need to be very agile in your style of work and the way that you communicate to be able to address these issues with your staff. Also, give yourself some credit. Most of us are doing the best that we can with the confusing and changing information that's going on. So while you try to make sound decisions in a fast-paced, moving situation, and being agile enough to change as more information is provided. Try to stay calm. That's the best thing that you can do for you and your team. Communication. Communicate, communicate, communicate. There are tools in file number 4 on the online file. Um, get used to the terms fluid. Things are fluid. Get used to the term evolving or the word evolving. Get used to managing change. All of those will become part of your normal vocabulary as we navigate through um, getting to back to a place of calm with the coronavirus. So make sure that you're communicating often your strategies for remote work or any of your displaced workers or interruptions in your work environment, whether you are shutting down programs, whether you're having modified schedules, whatever that may be. I would also advise you to make sure that you have up-to-date personal contact information on your staff or your employees, meaning their personal cell phone or their personal email address. You certainly want to make sure you continue to communicate with your dislocated and or disconnected workers if you're going to implement some remote work policies. And I'd also advise you about communication, that any of your plans, policies, and even promises that you make around this COVID-19 preparedness strategy, that you put it in writing. It's going to be so critical that everything that you communicate, you do it in writing, and including those promises that you make to an individual. Cooperation is going to be necessary and mandated during this time. There are federal, state, and local regulations and laws that will be put in place or that have been put in place, and others will be continue to be put in place as we navigate through this pandemic. I live in central Alabama in Jefferson County. Our county officials held a press conference yesterday on March 16th and rolled out some of the enforceable laws and orders that would impact our county. Now, your county, if you live in a different county, may have similar, very, very similar laws and regulations that are going to be enforceable and legally binding orders that you must follow. Some of the ones that were communicated during the press conference talked about an assembly of people of 25 or more, having 25 people or more in one common space. And the directive that they gave, in addition to limiting the number, was making sure those individuals in that space could be at least 6 feet apart from one another. There were regulations that were passed that limited the opening and operations of any senior centers, where senior citizens gather daily to do activities or to be fed. The recommendation was that you find a way to serve them externally. No visitation to nursing homes unless it was absolutely critical for the patient's care. Private schools and preschools of no more than 12 students or children together in one environment. And then also, the one that has the greatest impact is the food and restaurant industry. And the mandate being that no dine-in services were allowed, meaning that you could not have patrons come in and sit down and enjoy their meal in your establishment. Food and food industry restaurants are only allowed to prepare food that is going to be picked up, and that's generally outside of the organization, or delivered, pick up or deliver. The only exclusion that was given was for hospital cafeterias, where obviously people need to come together and eat, and they were going to up some of those precautions as well. Another thing about cooperation that may hit some organizations pretty hard is the unconfirmed discussions around shutting down businesses classified as non-essential operations. Non-essential operations. This simply means that If the government does not deem the work that you do to be essential to the health and well-being of the society, then you would be asked to close your doors temporarily. So essential, we can imagine essential operations would include things like grocery stores, pharmacies, hospitals, but it may not include retail stores that are selling fashion clothes and so on and so forth. Again, some of your programs may be sheltered, a workforce program may be put on pause, while other services that meet a critical need may be allowed to continue. Again, this is very fluid and it's going to be done on a case-by-case basis. So we will provide more information about that. And collaboration, the fourth of the C. Collaboration is where your teams come in. Unfortunately, we're not seeing a whole lot of succinct collaboration between the federal government and state governments. Prime example would be what we're seeing in New York, trying to take the lead to protect its citizens. We also, again, I'm in Alabama, and I'm recording this as of March 17th, and today the president was asked during a press conference about his contradiction of not recommending or setting guidelines that no more than 10 people be assembled together, where the governor of Alabama issued a mandate of no more than 25 people. And so there's a conflict and some confusion around, do we go with the 25 or do we go with the 10? And we're still trying to work that information out. I can't stress again how important it is to have ongoing communication with everyone, including your leadership team and your board of directors, as you prepare your protocols for dealing with COVID-19 and its impact on your operations and workforce. Best thing to do is get feedback and input from your staff, get support from your partners or funders, let them know what your plans of actions are, and then most importantly, continue to work and collaborate with one another, sharing policies and procedures and memos and best practices so that everybody is not trying to recreate the wheel at this most important time. But also communicating over and over again that these situations remain fluid, thus we must remain fluid and be agile enough to adapt to changes as they come out hour by hour. Notifications is a big question that I've been filtering through for the past 72 hours, particularly in Alabama as testing is being done and those test results are coming back. So people have been identified or have test positive for the coronavirus. And so what obligation do you have as a workforce to notify not only your team or your staff who may have worked around that person, but then also if you're open to the public like a retail store or have a lot of external traffic coming in for your services, what obligations do you have to make sure that you notify those individuals that you have a confirmed case of the coronavirus in your environment? More information is evolving about that. I will continue to update the online file, specific notices around workplace exposure to the coronavirus, but do some research on exactly what you need to do and what's required. I won't spend a whole lot of time talking about the federal government mandates, as many of these are still in discussion. The House passed a bill, sent it over to the Senate. I think the Senate has had it since Friday, and they're working through. But I will tell you there are three things and we could compartmentalize the plans and actions that they're taking around the workplace and assisting workers. One of them is under the OSHA reg, where there will be free testing for anyone who's showing symptoms or has possible exposure to the coronavirus. So that's under OSHA, the free testing. Under FMLA, the Family Medical Leave Act, there will be an extension for FMLA. And then the one that is quite a bit of concern and confusion at this time which may be the holdup between the bill from the House to the Senate, is the paid time off benefit and what employers will be obligated to provide paid time off. Again, at the time of this recording, those conversations and the exact bill is in discussion, and hopefully we'll have it rolled out within the next 24 to 48 hours. One good thing that came out of the press conference that was held today with the president and his team was that the Treasury Secretary mentioned the plans that were in the works and nearly finalized to be able to send cash to families. So sending $1,000 or whatever amount they agree upon to American families to help try to continue to stimulate the economy so that we don't take a deep dive and get into a recession, which is the debate on whether we're there or not. Alabama, sweet home Alabama. I will tell you, Alabama is following the federal guidelines pretty much on how they are rolling out regulations and acts related to COVID-19 in the workplace. One of the bigger issues is unemployment compensation. So on yesterday, which was March 16th, the Alabama Department of Labor rolled out their unemployment compensation rules to allow for workers to file for unemployment compensation who are affected in any way by the COVID-19 virus. And that included employees who were quarantined by a medical professional or a government agency, those employees who were laid off or sent home without pay, those who were diagnosed with COVID-19, or even those who were caring for an immediate family member, in most cases would qualify for unemployment compensation or unemployment insurance. And they've got some other criteria that's necessary. Employees will be able to go online and complete that information. The waiting week, which is typically the first week of payment, will be waived. So effective March 23rd, employees can start applying for that at the www.labor.alabama.gov website. One of the things that it did stipulate that there are employees who would not be eligible for unemployment compensation, and it included those who were being paid to work from home or those receiving paid sick or vacation leave. They would not be eligible for this situation. The last part of the requirement or the regulation stated that employers who decide to shut down due to the coronavirus concern should treat the shutdown as a temporary layoff. And of course, it mentioned that these rules are subject to change pending congressional action. So although Alabama has put in place its unemployment compensation plans so that those who are impacted the greatest by operations reducing their hours, reducing programs, or shutting down totally, as we're seeing with some retail establishments, it does give them some type of relief as we wait for additional recommendations from the federal government. Layoffs. So if you need to lay off an employee, this is a conversation again that many organizations are having based on exactly what they do and how they anticipate ramping back up after all of these regulations, shutdowns, the conversations about citywide quarantines or statewide quarantines. All of this information, again, is very fluid. So what do you do with your workforce? Of course, the unemployment compensation is instructing us to consider it as a temporary layoff. When we say a temporary layoff, all of that means is that you expect to call the employee back to work when things pick up, even if you do it in phases. That means that they continue their seniority. So, whatever seniority track they're on, they're still getting days added to their seniority that may apply to vacation and other paid time off. They continue their benefits that they currently have that are under you, particularly those that are employer paid. Now, that means if there is a shared cost in those benefits, you'll need to design a way to be able to recoup their portion once they return back to work. I'd also recommend that if they're going to be just in a temporary layoff status, that you continue to communicate to them What are you doing? What are your plans of actions? When they can expect to be returned? You want to make sure you stay connected with them. And then as far as payroll, they should just be placed in an inactive category from payroll. They should not be deleted off payroll, but they're just placed inactive where you're not applying any hours of work. Other organizations will make the drastic decision to actually downsize at this time and terminate staff because they know the long-term effect of having them there and also the financial impact. So when we separate someone or terminate them for lack of work, in both of these categories, whether they're terminated or they're laid off, they still can receive unemployment if they meet that criteria. But certainly if you terminate someone, that may end their seniority, that may stop their benefits, that means you're stopping communication, just as you would at any time someone resigned or was terminated from your company. Any type of separation that would apply. One of the things and that again, this information is subject to change based on congressional rulings and acts that are added to the current bill. The WARN Act is one of those things that are in place if you're going to be laying off 50 employees or more. It requires you to give a 60-day notice. There has not been any instruction on whether that will be waived. Our anticipation in the HR world and the legal world, we think that it will be because it's unreasonable to expect any organization to give 60 days notice before it starts laying off its workforce. In Alabama, just keep in mind if you're not familiar with the unemployment, the way that it's set up now, and I will say there may be some federal regulations that may change this. Some of the talk was around ensuring that employees stayed whole, which meant that if their average pay was $500 a week, that's what they would get in unemployment insurance. And so, again, we're not sure how that would work. Currently, under Alabama unemployment compensation, the minimum amount an employee could receive is $45 a week. The maximum amount is $265. So just think of the impact if you've got someone making $500 or $1,000 a week and they're only able to get $265. So the federal discussion is around doing a cap of at least $1,000 a week to make that employee whole, or averaging their pay. This would also apply, from what we understand so far, to part-time employees as well. So my advice is to evaluate the pros and cons of both options, whether you do a total downsizing or just a temporary layoff, whether map out your strategy, whether it's necessary that you do it in phases. Phase 1 will impact these programs or this department. Phase 2 will be this group, whatever it may be. I'd also recommend that if you have an employee assistance program or even an employee referral program to get assistance, that you share that information now as well, knowing that there would be a significant reduce in pay and just their normal daily lives and working and interaction with one another. Employees will be stressed out and employees will be depressed or experience some form of depression during this time. So any resources that you currently have in place should be extended to help minimize the impact. Remote work or work from home is another big issue. I will tell you now that there is no one size that fits all. Every organization will have their own different and unique needs. Every team is different. You will find information in the online file that talks about telecommuting policies. I've also listed guidelines to prepare for remote work. There are sample memos for temporary work, temporary remote work. I also provided a list of free access to those who may need to work from home, who may not have the internet. We automatically assume everybody has the internet in their home. That is not quite true. And so organizations like Charter and Xfinity are putting together packages to provide free internet access, primarily for students and those who are impacted because they can't go to school. But then also they're including some other individuals in that category as well. So some of this may be income based, income may need to be verified, but again, those resources are coming and they're being announced by the hour on what organizations are willing to help and waive or reduce costs to provide internet services for those who are working from home or trying to do schoolwork from home. And then also in the file, you'll find some software, a list of software or apps to help you manage productivity and accountability for those who will be working from home. So take a look at that information. And again, I'll welcome any questions that I can to help clarify those details. You need to be concerned about discrimination in the workplace. There will be some grace shown in um, you making the decisions that impact your organization around, whether it's Department of Labor, FLSA, all of these things where you're trying to do the right thing for your employees. One of the things that they're probably not going to show any grace and mercy on is you allowing discrimination to happen. So think about this. If you're downsizing or you make the decision to downsize your workforce, you need to make sure that you're consistent and doing things that are across the board and not singling any particular group out, i.e., you decide that you're going to terminate all of your toxic employees, if you have any, and all of those employees will be issued a termination letter, and then you lay off some, and they're similarly situated. So that could cause or create some red flags. If you're going to lay off some individuals or terminate some individuals, and the majority of them are 40 and above, so you go into the Age Discrimination Act. So you do need to use some caution in identifying who may be impacted by your layoff policies and procedures or your remote work procedures. You also need to be aware of toxic conversations and terms and communication. This is not the Chinese pandemic. This is not the China disease, which has been said by leaders in our federal government. Those things can be viewed as discriminatory terms. Again, making sure that you're not excluding or um, having indifferent treatment, whether by leadership or by coworkers, of someone based on their race, nationality, and even their proximity to race and nationality of an individual, meaning that they have a relationship. I may be African American, but my husband may be Asian or maybe from China, and I'm making those comments, and then they can be deemed as discriminatory. So the same treatment across the board is the best way. There are also some concerns around ADA and a person having an illness. I know that we're in the season for seasonal allergies and pollen. So be careful and be cautious of employees making comments about someone sneezing in the work environment, automatically assuming because of someone, again, their ethnicity, that they may be in proximity to someone who has been diagnosed with the coronavirus. And finally, just some tips and strategies and plans that you need to think about as you go through deciding how you will streamline your operations to comply with a number of the local, state, and federal regulations that are being put down literally by the hour or sent to us literally by the hour. Continue to do some common sense things. File number 5 in the online Dropbox file has some infographics and posters that you can email to your team or put around your office space that really cover some basic common sense things that we should do and should have been doing to help with just the basic common cold or the flu. So putting signs up and reminding people to wash their hands and wash their hands frequently, advising individuals to cough in their elbow and not in their hands, having hand sanitizer and cans of disinfectant all around in office spaces, common spaces like the mail room or copier room, in conference rooms, any office space, any space, period, should have those items handy. And you should have conversations with your staff saying, we're going to use them and we're going to use them frequently. so that no individual person is offended if somebody picks up a can of Lysol and starts spraying. Just know that that becomes part of your common practice and the way of work. Also, if you're going to be open in any capacity, upping your cleaning routine. So you may have a janitor come in or cleaning service come in once a week. You may need to up that to 3 times a week if you're still going to have employees walking around and working with one another. This information is fluid, so we'll continue to get recommendations, guidelines, and so on and so forth from the federal government, local government, health agencies, and the CDC as well. Last but not least, do your research. I repeat, I am not the coronavirus HR expert. I am just sharing information based on meeting some of my client needs and being willing to share this information with other organizations. My advice is to go to the cdc.gov to get information. And again, this information is being rolled out on an hourly basis. And I'm sure your email box is inundated with those who you partner with, shop with, interact with about their COVID-19 plans, whether they are shut down, modified schedules, or whatever. So there's tons of information out there. I'd say definitely get your information from a reputable source. I am sharing on the next slide my email address and phone number so that if I can answer any specific question, or if you would like for me to add an additional tool to the toolbox, although it's being updated literally every other hour as I'm receiving information, then please don't hesitate to reach out to me to do that. And as I mentioned, some of the stuff that I'm sharing may be outdated within 24 hours because things are consistently changing. So you just want to make sure you're staying up to date and checking the box frequently, or looking out for emails about updated information as well. And that is it. Again, I'm Melva Tate. I hope you found this information helpful and beneficial so that you can be strategic in your plans in dealing with the coronavirus impact on your organization and your operations. Y'all be blessed.